Good morning, everybody. My name's Kevin Harter. I'm the CEO of York Care Center and the York Group of Properties. Let's follow along with the thing. Everybody from New Brunswick, raise your hands. We are the little engine that could. There is no doubt about that. We are working hard to punch way above our weight when it comes to data and quality improvements. First of all, fair warning, one of my least comfortable things is being in front of a room talking. One of my more comfortable things is talking about something that I believe in and am passionate about. And unfortunately, these days, I find myself in front of rooms a lot more than I ever thought I would be. And if I'd known that 3 years ago sending data to CIHI would cause that, I might have rethought that process without a doubt. This journey began with us about 4 years ago when I was hired as the CEO of York Care Center. My boss, the board chair, came to me and said, "We call ourselves a center of excellence in aging care. Now I want you to prove to the board that we are a center of excellence in aging care." And I went out and started looking at it, and we had a lot of great stories from families that said we were good. We did a lot of great things, but we had no real data to support the front staff and to support this theory that we were a center of excellence in aging care. So we said, what are we going to do about that? Now, obviously, more often than not, you focus on two things in long-term care. What's the quality of life for our residents, and what's the quality of care that we are providing them? There's many other things that come into play, the satisfaction of the staff, et cetera, but today I'm just going to be focusing on these two things. And quality of life was something we picked up early because you get a lot of metrics on your care results. Not a whole lot of people do a lot that is structured in regards to quality of life. So we were a part of a Senior Quality Leap initiative. Has anybody ever heard of them? It's a group of organizations that have banded together to try and develop or ensure to support best practice in many areas to move our needles to the higher levels that we can. And InterI is one of our supporting members. And they brought forward this theory of doing their quality of life survey. And we hopped on it and said, let's see what it does say overall. Is anybody familiar with the InterI quality of life survey? Raise your hands if you've heard of it, used it, thought about it. Oh, a lot of people, that's great. There's a number and quite a few different items that deal with many different aspects of a resident's life. There's demographics, you can sort of understand what the residents are. Staff responsiveness, resident personal control, resident social life, 3 items dealing with food, and thank God there's only 3 because that's one of the more challenging ones. And 5 items dealing with resident closeness to staff. Now we do this as a bit of a blind survey. We have, we're very fortunate at St. Thomas University right by us. There is a gerontology course. And we bring in, and a lot of their students come in and volunteer. So we give them the task of doing these surveys. So it's not a staff member, it's not somebody that they have to be worried about reporting to, it's not somebody that directly affects their care or anything. They can be as honest as they want in this survey. So some of the sample questions: I'm treated with respect, I decide when to go to bed, staff pay attention, can participate in religious activities, staff respond quickly, control who comes into my room, participates in meaningful activities, enjoys mealtime, and staff act on my suggestions. So, and the responses are things like never, sort of, or sometimes, often, always. And for our purposes, we focused in on the often and always. Now, one of the key things that you have to do, and unfortunately my table will be very bored with this as we spent a lot of time talking about it before, is you got to understand what your data is telling you. Just because you're getting a 90% doesn't mean you're doing good. And because you're getting a 20% doesn't mean you're doing bad. So InterI brought to the table about 4,000 responses where they benchmarked what is the 20% level. So you know if you're doing below that level, you're in the worst 20% of the group. What is the 50% and what is the 80? So we can have an idea of where we were at overall. But benchmarking is key because high numbers doesn't mean you're doing good and low numbers don't mean you're doing bad. You got to be able to look at everything overall and you got to be able to look at context. One of the things we did when we were first doing this is one of the questions is I can go outside when I want. And the first year that we did this, we scored very poorly on it. And we were looking at it and I thought, well, you know something? We did this survey in the middle of one of the worst winters New Brunswick has been having for the last 10 years. So maybe there was a little bit of effect on the answer here. But you got to be able to take everything into consideration. So when we came in, we looked at, if you look at this, we took everything, we broke it down. And what we really concentrated on were where were we below 20% and where were we above 80. So we brought it in and we looked, and in the 2015, we had 5 results below 20 and 3 above the 80. Now, what we did is we sent out to our managers and said, okay, I want to see action plans, but I want to see engaged action plans. This isn't you coming back saying, I'm going to do this. This is you talking to everybody. In order to support that, we shared this data with everybody and engaged them. We shared it with the residents, the board of directors, the staff, the families, the community, anybody who would listen to us. We shared what our results were. And, in the areas where we weren't doing very well, those weren't challenges, those were opportunities. An opportunity for us to look at it and figure out how we could do better. So when I sent my managers out to develop the action plan, we had shared this with everybody, and they were to go to resident council, the family advocacy group, the staff members, and get them engaged so that when they came back with an action plan, it just wasn't something they put together. I had one manager come back and said, we're going to do better. And I said, we're going to do the same thing we were doing before where we failed, but we're going to do it better. What are we going to do better? How are we going to do that better? And sent him back to the drawing board. So at the end of the day, we had provided a culture where our managers could engage everybody and be able to discuss what the issues and be able to come up with a plan that was 360 degrees. It wasn't just what the staff thought, it wasn't just what the residents, what everybody thought. It took all the input from everybody to be able to come up with it. So it's very key that you go out there and share and engage. That was a key part of our success. And if you look at it, in 2015, we had 5 items below 20 and 3 above 80. In 2016, we had 1 item below 20 and 5 above the 80. So by engaging everybody, by including them, by asking for action plans that had a full range of how we follow up, how we identify what we're doing and how we're doing, we were able to go through and move ourselves from a 5 and 3 to a 1 and 5. Now we'll start looking at everything where we're under the 50% to move that above it. Quick thing here, we do this also for our quality indicators. As we picked 11 of the, is anybody familiar with the Q35 from the MDS system and all? We pick 11 of these quality indicators and we look at where are we below 50, where are we above 50, where are we above 80, and where are we below 20. And the goal that we have is to move everything. And as you can see, our progress has been, now we're not doing as well as we'd like to do with above 80, but we moved almost everything to the above 50 mark so that we're doing better than half the homes out there. Future. We want to do a couple of things in the future. First of all, we want to work with InterI to develop the family portion of this. A lot of our residents are not cognitively capable of doing this. We want to hear what the family says and get their feedback on it. The other thing we want to do is be able to find a way to be able to access staff satisfaction and tie it back to this to see if there's anything in there that helps to move the needle. Working on improving the food may not be the entire solution. Maybe it's working on staff understanding or staff feeling better about this or whatever. So our goal is to be able to look at everything to be able to determine what moves the needle where and how can we be a part of moving that needle. Thank you.